My name is Pat Souter. I'm General Counsel for Safe Harbor, also of counsel with the law firm of Gray, Reed & McGraw, and Professor of Healthcare Studies at Baylor University School of Law and the Baylor University School of Business. I graduated from Baylor University School of Business with a BBA in Finance and also from Baylor Law School with my Juris Doctorate. I've also obtained my MBA in Health Services Management from the University of Dallas. In my teaching career, I've evolved from just one healthcare class to such things as regulation of healthcare professionals and teaching classes in fraud and abuse. So much of my practice involves people that I have personal relationships with because I truly believe that I need to be involved, and from a business standpoint at that level as anyone would be in their business. Even though that they're just a client, they're more than a client to me. People come to me because they want to make sure that they're doing the right thing. And in my capacity, that's what I need to instill in them, the confidence that we are doing the right thing. So my passions really drive towards making those people feel that they are doing what they're supposed to be doing, whether it's from a legal standpoint, whether it's from a business standpoint. Clients such as Safe Harbor come to me to ensure that they're complying with the law. And I've found that from the top all the way to the bottom at Safe Harbor, they're committed to not only complying with the law, but making sure that those that they deal with comply with the law as well. In the healthcare industry, it's important to wear the white hat. You don't want to be the one that is questioned in the industry. Safe Harbor ensures that they're not questioned in the industry. The U.S. healthcare industry has gone through significant changes over the past 5 years, and you're going to see further changes over the next 5 to 10 years. Personalized medicine, ensuring that drug interactions are appropriate, dealing with different types of genetic testing are all going to be important because of the fact that the government wants to ensure that the patient is receiving quality care. And the only way to do that is to actually personalize that to the patient and not try to do it as a one-size-fits-all approach to medicine. The Affordable Care Act focuses in on population medicine and best practices. And as I had mentioned before, those types of things that personalize the medicine to the patient is what the government is striving to achieve, not only from a regulatory standpoint, but from a reimbursement standpoint. And the government is going to continue to push those types of things as we go 5, 10, 15, 20 years from now. Because of an older population, we have to control costs, but make sure that we are providing quality care. And that's the only way to do it, is to make sure that there's a linkage between the person and the care that they're providing, rather than just the old look it up in the book and apply some type of medical decision that you would do not based upon an individual's problems, but the disease itself. Safe Harbor has positioned itself to ensure that that personalized medicine is achieved, as I mentioned before, all tied back to quality. It's all tied back to the appropriate care. And Safe Harbor, through such things as the studies that they promote to test different types of pharmaceuticals, different types of laboratory testing, and more importantly, even compliance efforts that they promote, all tie back to the need to make sure that the person gets the type of care that they need. I've witnessed the mission of Safe Harbor on a first-hand basis. There's concern regarding the patient. There's concern ensuring that the providers of the care for those patients have adequate tools to be able to provide the appropriate care, but also to judge whether that care is the one that is the optimal for each patient. Safe Harbor does that in a compliant fashion.